So what you're going to first experience is basically the HydraFacial. Have you ever had a microdermabrasion? Okay, so microdermabrasion is a mechanical exfoliation. So a lot of people, when they're brand new into the aesthetic industry, they may have had that. It's kind of a nice way to put your toe in the water. However, the HydraFacial is like that on steroids. It's the best way I can kind of get patients to understand. So we are talking about mechanical exfoliation, but the addition is it's also adding in the infusion of serums. There's essentially 4 different phases for the treatment. So the first phase is what they refer to as their Vortex cleansing and exfoliation. So it's essentially using lactic acid and glucosamine to soften the debris on the surface of your skin. So with each phase, we're going to get a little bit of a deeper exfoliation. The next phase we're going to go to is what they refer to as the mini acid peel. So it's a very slight chemical peel is how they reference it. So we're going to change our tip, and when people hear chemical peel, immediately they become alarmed that there's going to be downtime, there's going to be discomfort. But this is a very low percentage, and this can be customized. You can increase the strength as you go along in this piece of the phase if you wanted to have a little more aggressive peel. But there's not going to be any desquamation, no peeling on your part. It's just going to be a little bit of a deeper exfoliation than if we did not include this. Now we're going to go on to the next phase, which is the beta hydroxy again, and this time they call this the vortex extraction. So essentially what we want to do here is really concentrate in the T-zone. When we were initially trained on the HydraFacial, and of course we all know that trends and patient outcomes sort of dictate protocols, and so what we're finding more and more when you're talking with acneic or oily skin patients, but realistically all skin types, is that your larger pores are generally going to be in the T-zone. Even though you've identified that you also have dry skin, a lot of times people, when they think their skin is really dry, it's really more in fact dehydrated. Okay, so we're going to change our tip again. And this is where we would do a specialty vial. So if we wanted to be a little more aggressive, we certainly can, but in your situation, we're not going to do that. So like, you don't really have discoloration, you don't really have the need for extra rejuvenation because you're still young, you're 24. Someone like me, you know, you could definitely add in a specialty vial to address hyperpigmentation and those sorts of things. So we're just going to kind of use the peptides to address your hydration, okay? So this is what they refer to as the fusion. So basically what we're going to do here is we're going to feather. You're going to feel a little bit of a different stroke on your skin. It's not tremendously different, but we really want to, these last little bit, we really want to hydrate the skin.